Good afternoon. My name is Lucy Aquino, and I'm the Chief Executive Officer of Hispano Care, Inc., a program of Advocate Illinois Masonic Hospital and affiliated with Gottlieb Memorial Hospital. And today, we bring to you, and we're bringing back actually, Dr. Mark Keldhal from Advocate Illinois Masonic Hospital, who we're going to be speaking on veins, spider veins, and all kinds of things like that of interest. Now, Dr. Keldhal, first of all, I want to wish our viewers a very happy new year. Welcome to 2012. I'm hoping that it'll be an exciting year and a good year for everyone. And on that note, happy new year and welcome back.
Happy New Year.
I'm glad you're back.
Thank you for having me back. I'm looking forward to coming back and speaking with you and your viewers.
Well, our last topic was very interesting, so we wanted to make sure we started off the new year with you. Especially since we're only, 6 months away from summer?
That's right.
So why don't we start by saying, Dr. Keldhal, can you tell us a little bit about yourself?
Sure. I'm a vascular surgeon. Vascular surgeons typically begin their training, obviously after medical school, becoming a medical doctor. They do another training. They do more training in surgery. So I happen to do a 5-year general surgery training program. And then I subspecialized in vascular surgery, which is specializing in all of the arteries and the veins in the body, specifically the neck, the carotid artery, the aorta, which is a large blood vessel in the chest and the belly, and all the blood vessels in the legs and the arms, arteries and veins.
Well, this topic is going to be interesting, not based on what you do and based on what we're talking about today. But I do want to remind our viewers that our lines are open. Again, thank you for joining us on CAN TV 21. Numbers at the bottom of your screen, area code 312-738-1060. Now, Dr. Keldhal, we talked a little bit about what you do, but can you tell us what is, we hear this all the time, varicose veins, spider veins. What is that?
Well, I always tell my patients, I always back up and they ask me about vein problems, and I say, well, let's go to the basics. So everybody knows that the arteries bring the blood flow down the leg. So that's from the heart, and the blood vessel going down the chest and the abdomen is the aorta. That splits and turns into the femoral arteries, which goes down the legs and brings blood all the way down to the feet. So when doctors are examining your legs at the doctor's office and your feet, they're checking for the pulses in your feet. You should have two pulses, one on top of the foot and one on the inner aspect of the foot. So that's the arteries, and we touched upon a lot of this on our last
show.
Last show. So that's the arterial flow, and just checking for pulses. Now the veins bring the blood back up the leg and all the way back up to the heart. So it's basically a circuit, a plumbing circuit. Veins in the legs, there's two types of veins. There are the deep veins and the superficial veins. So the deep veins, no one can see those. Those are deep, deep in the leg. They're under the muscle, and they're the very large veins called the femoral vein and some other names as they get lower in the leg. Those carry about 90% of the blood back up the leg. Now there's another system called the superficial venous system. Those are veins. They're smaller. You may have heard of these called the saphenous vein. This is in the inner thigh and going down the inner leg all the way down to the foot. This is a smaller vein, and both this vein, the saphenous vein, and the deep veins, or the femoral vein we'll call it, they have little valves in them. And there's little valves every about ½ inch, all the way up the leg. So I tell my patients blood flow needs to get all the way up the leg. And I tell them it's like a ladder. Blood has to go through each one of these little valves, and it goes up and stops, and it goes up and stops. And those valves are one-way valves. You only want blood going up the leg. You don't want it to go back down. So all these little valves they open, blood goes up, the valve closes, and then the blood is waiting to go up the next valve, like a ladder.
Like in steps.
Exactly.
Right.
So varicose veins is one of many vein problems, and that is typically a patient has leaky valves. So the valve's supposed to open and blood goes up, but what happens when it closes, the valve is leaky, and the blood goes back down again. And you end up with excess blood in the veins in your leg. And what can happen over time is those veins with excess blood can get bigger and dilate and get enlarged. And especially the superficial veins or the saphenous vein, the one typically on the inner thigh and down below in the inner leg, those can bulge and people can see those bulging veins. It almost looks like we describe it as like a bag of worms under the skin. You've probably seen these before. Yeah. Varicose veins are very common in women and men.
Right.
And these are what the varicose veins are. They're bulging veins, and they are basically...
So those are the ones you kind of sort of see. They're thick on top, unlike the spider vein, which is...
The spider vein is much smaller. It's similar, but not exactly the same. Spider veins are very small. They're just tiny little hair-like veins, and they can be purple, they can be dark red, they can almost be black in color, and they look like little tiny trees under the skin, kind of with little branches.
Sure.
And these are cosmetic, and these spider veins are not always linked to bad valves, as I was telling you about the valves in the venous system. Right. These can be totally separate from the valve system. Sometimes we have patients with spider veins and they have bad valves.
Right.
Then we have to start talking about how are we going to fix this problem. But to separate the two, varicose veins are the large bulging veins, and the spider veins are those small ones, cosmetic ones. Exactly.
Well, so then that leads me to then, how common are abnormal leg veins? I mean, are they common, very common, uncommon?
They're very common. I mean, I see, just in the last few months, I've seen probably 200 to 300 patients that came to me for consultation about their leg veins. What's very interesting is the majority of people that have varicose veins, which are the bulging veins, are asymptomatic. They don't have any symptoms whatsoever. They just kind of look different. They have this bulging vein under their leg. And a lot of people don't know if they're dangerous, if they should have them fixed. Are they at risk for any blood clots or something like that? So they end up seeing me in consultation just to kind of go over, is this a problem or should they get it fixed?
Sure. So the factors, what factors increase the risk of varicose veins or spider veins? I mean,
sure.
Is it age? Is it history?
Yes,
medical history?
Exactly. That's correct. Age is one. As people get older, the veins tend to not work as well. Females tend to have the vein problems more than males. I have plenty of males in my vein practice, which I treat, but the majority of my patients are women, and we believe, the medical community believes, that there's some relation with estrogen and progesterone, the hormones, higher concentration in women, that maybe has some connection with these valves not working as well. It could be a relation to the female hormones. But then again, it can't only be that, because we do see it in males also.
So you got like a 55% women, 45% men ratio.
Probably a little more.
Or something like that.
Even a little bit more, right? On the female side. Wow. But they're quite common, and I bet you most patients don't even tell their doctors they have them and don't even seek treatment because they don't bother them. They're just a cosmetic thing where maybe if they happen to go to the beach a lot or the pool and wear swimsuits, okay, maybe they're more in tune to saying, oh, I have something going on here. But many people wear pants maybe year-round long.
Some don't even notice it because it's behind them, and especially if it's in the back of the leg.
Exactly.
Well, and I also understand that I hear a lot of women tell me that they actually have gotten these spider veins and varicose veins after pregnancy or during pregnancy. Can we talk a little bit about that?
Yes. Again, that's most likely related to hormonal changes.
Again, right.
Many patients, women who have children, notice that they get, all of a sudden during pregnancy, their veins start bulging in their legs. Now, we always tell women during pregnancy, don't worry about it. Wait till the pregnancy is over, and there's a good chance that the veins may disappear, those bulging veins. If they don't disappear, then we can talk about what do we do to treat those later. But again, it's most likely related to the hormones, the estrogen, the progesterone, that are found higher in concentration in women, and even get higher during pregnancy. Another interesting thing about pregnancy is the body during pregnancy has extra blood in the body to help the baby grow, and needs extra nutrition and extra blood. So when you have extra blood now in the body, again, going back to earlier, there's extra blood in the leg veins. So it's easier for those leg veins to bulge and get larger and turn into varicose veins.
Well, and usually, now, I read, I don't know if this is true or not, but I read that usually after pregnancy especially, that it's pretty much should clear up if there are no issues within 3 months after delivering.
That's correct. I tell my patients that are during pregnancy or just after pregnancy to just relax, take a deep breath,
Take
take it easy. One of the big things we'll probably get into for treatment is compression stockings. I tell females if they have during pregnancy or just after, try some over-the-counter compression stockings. I happen to give prescription strength compression stockings, and they're a little more expensive, but they're tighter and they work a little bit better. But even over-the-counter stockings, whether it's knee-high or the thigh-high stockings, work very well for women in pregnancy or after pregnancy.
Wow. Now, this is a topic that, of course, everyone's talking about, is the obesity epidemic, which obviously it's a health issue across the board, but it also affects the veins as well.
That's correct. Oh, bless you.
Excuse me.
That's correct. Many of the patients I see also are overweight, and obesity is obviously, as many people know, the United States is having a big problem with people being overweight and the sedentary lifestyles and the poor diets, and people are getting more and more health problems due to obesity. We do see the vein problems, the circulation problems more frequently in the obese patients. One of the first things I do tell the obese patients, which I'm not the first one to tell them, is if you lose weight, this problem will probably get better.
All right.
But this is just one of many problems that obese patients have, is the varicose veins, and they may be suffering from other problems that may even be more important than the varicose veins.
Right.
So again, I tell them, why don't you try some compression stockings and see how that goes for a few months.
Right. And of course, lack of movement and all that.
Exactly.
So, Dr. Keldhal, why do varicose veins and spider veins usually appear in the leg? I mean, why not the rest of the body?
It has to do with gravity. With when you're walking around all day, all that blood from the groins down, the legs has a lot of gravitational pull. The body has to do a lot of work to get that blood all the way up the leg, all the way up the abdomen, all the way up the chest, back to the heart. So it's really a distance thing and a work thing. So it's easier for blood to pool in the veins in the legs because it's just harder for that blood to work up that ladder we talked about to get all the way back up to the heart.
I do want to remind our viewers that with me today we have Dr. Mark Keldhal, vascular surgeon, affiliated with Advocate Illinois Masonic Hospital, and our lines are open. So if you have any questions regarding spider veins, varicose veins, or for a vascular surgeon, please give us a call. Our lines are open. Area code 312-738-1060. So what are the signs of varicose veins? Are there actual signs and symptoms for them, or it just happens?
Well, signs of varicose veins are, does the patient have bulging veins, which looks like kind of worms under the skin? Those would be the signs. Symptoms can range from nothing. The patient may have no pain whatsoever, no symptom, no nothing. Or the patient can have, we call symptomatic. So the different types of symptoms people feel are frequently a feeling of discomfort or heaviness is a very common thing I hear. Sometimes people say, specifically at the end of the day when they've been standing all day, walking during work or walking all day, when the blood is more prominent in the legs, there's more blood in the legs trying to get out, is they might feel pain. And the pain can be different for every patient. It can be they feel a burning sensation, they feel a pulling sensation, but heaviness and fatigue, that's a common one.
Okay. Now, how about swelling? I've heard that swelling also comes along with that, and possibly rashes and itchy or irritated areas. Is that also a symptom?
Yeah, and that's starting to go into a whole nother arena of vein problems.
Okay.
So I tell my patients, if they do have vein problems, they can have varicose veins, one thing, the bulging veins. They could have spider veins, which are those flat, little cosmetic ones, or they can have a whole separate. They may not have varicose veins or spider veins. They may have just swelling. And I do see a lot of patients that have really bad swelling in just their legs, especially as they get older. Then their doctors send the patients to me for consultation to see, could it be a vein problem?
Okay.
Swelling in the legs can be from a variety of reasons. People that have congestive heart failure is a common reason that people have swelling in both legs. People that have liver disease and some other medical problems can have swelling in the legs. And also obesity, as we talked, being heavier. So various things can cause swelling in the legs. Usually looking to the veins is one of the last things the doctors look at before they rule out all the other more serious causes.
So are spider veins, are they dangerous?
Spider veins are not dangerous. Spider veins are cosmetic. So when patients come and see me in my office, spider veins is the one vein problem that insurance does not pay for because it is purely cosmetic. There's been a lot of research and studies over the last 20, 30, 40 years proving that spider veins don't cause patients harm. They don't hurt. They don't bother you whatsoever. They just look different. And people that want them treated, I can treat them. It's a very simple procedure. It's in the office. And basically you take a very tiny needle and you take a little medication and inject it into those little tiny veins. And basically it kills that vein. And it goes away. Oh. And the body just absorbs, it kind of bruises at the beginning, and then about days later and a week later, it disappears. Some people need a second treatment just to make it go away completely, but they are not dangerous.
So if I had varicose veins, let's go back to that. And we know that spider veins are cosmetic. Now, varicose veins, on the other hand, is it something I should see my doctor, obviously? And two, you mentioned that insurance may cover this, though.
Correct. So for spider veins, insurance does not pay because it's cosmetic.
It's cosmetic.
It's cosmetic. Varicose veins is also a little trickier. Insurance companies will pay for varicose veins if they're symptomatic. So the patient has to have symptoms, whether it be pain or swelling or heaviness, some sort of symptom that's really bothering them.
Interfering with their daily lives.
Correct. If varicose veins do not bother the patient, there are no symptoms, they just don't like the way they look, we are back to cosmetic again, just like the spider veins. And insurance companies typically don't pay for that because it's a cosmetic procedure and it's not a medically necessary procedure.
Okay. So how are varicose veins diagnosed other than the surface ones that you see with spider? If you had varicose veins, and as you mentioned, some of them can be deep where you don't see them, how is that actually diagnosed?
Most of the time you can see them just with a physical examination in the office, or someone's coming to you with bulging veins. The diagnosis is pretty clear when you examine someone's legs in the office. The deeper ones, typically you don't see varicose veins deeper in that deep venous system that we talked about. It's going to be in the superficial venous system. The little vein, the small veins, typically the saphenous vein under the skin. That is the one that bulges up, and then little branches can come off of that saphenous vein and also bulge, and you can see little networks of bulging veins. So that is how we examine it. But after examination, I almost routinely will recommend to the patient to get an ultrasound. And an ultrasound doesn't hurt. There's no needles involved. There's really minimally almost no radiation involved. There's just a little tiny bit, but nothing like an X-ray or a CAT scan or anything like that. And basically a technician puts gel on the leg and takes a little probe connected to a machine and runs it up and down the leg, and they're checking those valves that we talked about. They're seeing if those valves open and close correctly, or do they open, close, and then are they leaking? And they don't look at each valve specifically, they look at the direction of blood flow. So during the ultrasound, you want to see blood flowing only up the leg. And they squeeze the leg during the examination, and they look for blood reversal. And if blood goes back down the leg on the ultrasound, we know that the valves are no good there. Exactly.
I do want to remind our viewers that with me today, we have Dr. Mark Keldhal, vascular surgeon of Advocate Illinois Masonic Hospital, here on Halsted and Wellington in the north side. And should you like to reach Dr. Keldhal, if you have any questions or like to talk to him, you can reach him at area code 773-296-3390. Again, that's 773-296-3390. And Dr. Keldhal, we have a caller on the air. Caller.
Hi.
Hi, how are you? Thank you for calling. How can we help you?
Yes, I would like to know, I don't know if this is varicose veins, but sometimes when I see, like I've been working out, and sometimes when I see guys with big muscles and different things like in the arms and in the hands, is that the same thing or is that something different?
Thank you for the question. that is typically something different. We've been talking mainly about the legs because that's really where we see varicose veins. Like the caller was asking about muscular patients, there are two superficial veins in the arm, and that's called the basilic vein and the cephalic vein. Those are the veins that they just get a little more prominent, and you see them typically in a straight line, and you can see it on the inner arm of the guys doing the bicep curls and all the weightlifting. And that's not a varicose vein. That is just a more prominent vein superficially right under the skin. And when people have very little fat under their skin and very muscular, the veins are more prevalent. You can see them much easier. Same thing, and I get a lot of questions about hands. And if you look at most patients, you can see the regular veins in your hand. If you just look at them, and if you squeeze your arm a little bit or hand a little bit, sometimes they come out a little bit more. But those are just normal veins. These are not varicose veins. My veins are kind of prominent. Yours aren't. So yours are pretty flat there. I don't really see yours very well. But
I have a hard time drawing blood.
Yeah, you're probably a hard stick with the nurses. They probably don't like you very much.
No, they don't.
So I think that a lot of people think that these could be varicose veins, but they're really not. They're really just a normal veins that are just more prominent in certain individuals.
I hope we answered your question.
Yes, thank you.
You're welcome. Thank you for calling. Now, doctor, you had alluded to compression stockings, and is this something that I know you recommend? It's recommended. But sometimes, I've even come across folks who are telling me, this stuff doesn't really work. It should work, though. I mean, you're prescribing it. There's a reason for it.
Yeah, they do work, and it's actually the gold standard treatment. Whether someone has symptoms or they don't have symptoms, I always tell patients, try compression stockings. If the varicose veins are only in the below knee area, in the calf or the inner calf, then I would tell them to wear knee-high compression stockings. And the idea is you only want to wear the stockings during the daytime. You don't have to wear them at nighttime, because when you're laying flat, it's easier for that blood to get out of the leg. So you don't need to wear them at nighttime. You only need to wear them during the daytime, and especially when you're doing a lot of walking and activity, because it's, again, more blood flowing and it's harder to get that blood out of that leg. Now, over-the-counter compression stockings, they're good, but if people have symptomatic varicose veins, they really probably should see a specialist like myself, and we can have a discussion about getting that ultrasound, seeing if their valves are working well or not working well, and then getting the patient into prescription strength compression stockings, which are actually measured. You go to a pharmacy or a local area, here in Chicago there's dozens of areas, and they measure the ankle just below the knee. And if you need a stocking to go all the way up to the groin, the thigh-high stockings, they measure the thigh also. So you get a very good fit and a perfect fit.
So it's custom.
It's almost custom.
It's almost custom.
It's almost
and insurance
custom.
covers these, don't it?
Insurance does cover that. Medicare, so the patients that are 65 and older that only have Medicare, typically they do not cover compression stockings. But all of the commercial insurance, like a Blue Cross, Humana, etc., these other commercial people that are working and have they typically cover, but you'd have to check with your provider directly, because every insurance is a little different.
Now, I know let's go back to spider veins. I know that aside from some of the treatments, it's cosmetic and everything else, but that's you mentioned a little bit with an injection treatment. Is laser treatment also done for this?
Laser is done for spider veins.
Okay.
Some other specialists don't do the injections. Some specialists, like dermatologists, for example, I know personally, do laser treatment. And it's a laser where they just put it right against the skin, and that's the laser treatment we're talking about. It's superficial, direct contact to the skin. The laser, in my opinion, I know other doctors may disagree if they don't do the same treatment, the injection treatment, I believe doesn't work as well in the spider veins in the legs. The injection that I talked about earlier works very well, and it has excellent cosmetic results. It is very easy to do, and it usually takes care of the problem for years and years and years. So yes, lasers are available for that, but I typically only do injection therapy for the spider veins for the legs.
Well, our time goes by so quickly here. We never have enough time. But again, I want to remind our viewers that should you have any questions or you'd like to reach out to Dr. Keldhal, you can reach him at Advocate Illinois Masonic Hospital at area code 773-296-3390. Again, it's 773-296-3390. Wow, our time goes back. I gotta have you back. There's other things that we want to talk about other than veins, so you gotta make me a promise to come back.
I promise.
On behalf of all my colleagues at Spinal Care, Advocate Illinois Masonic Hospital, Gottlieb Memorial Hospital, and Dr. Keldhal, thank you so much for coming and being on the show. We want to thank our viewers, too. If you have any questions, as always, don't hesitate to call us over at Hispano Care. We're here to serve you. Have a wonderful evening and have a wonderful new year. Until next time, we'll see you soon. Good night.